Thanks, Makwellings. That's brilliant. Thank you very much for that presentation. Just before we go on to some of the questions from the audience, can I just ask you, Makwellings and Tasawan and Ravikanya, did you have to adapt the approach to your context in Malawi and Thailand? Can you talk about that, please? Maybe we can start with Ravikanya and Tasawan.
Hi, so you're talking about okay, so we're talking about the adapting the context of AMR to Thailand. So I felt that yes, AMR is a very kind of like culture specific. I mean, like there's language that AMR and antibiotics like use, and at the same time in the same language, for example, in Thailand, there are language of AMR which lay people understand, and the language of AMR where health care providers would understand. So of course, like, you know, by adapting them, we really want to get everyone in the same page so we can understand like the complexity of AMR. Yeah.
So what I meant was adapting the dialogues approach. Did you have to change the plan in any way to implement it in Thailand?
I'm sorry. So it's just, can you please repeat the question one more time?
Yeah, sure. I'm just interested in the overall strategy and the plans and the methods of the engagement, the dialogues methodology. Did you have to adapt that to Thailand? And if you did, in what way did you have to change the methodology at all?
Alan and all the guests, I'm part of the members of the team. So I'm helping the team to answer the questions.
Okay.
In of adapting the strategy and methodology, as Ravikanya mentioned that we use the Welcome to Kids framework as our methodology. We sort of stick on the three key methodology, but we adapt and adjust. The first thing is, for example, language to suit culture and some language specific. But the strategy itself, we try to follow the Welcome to Kids framework. Let's say we don't really change the strategy, but we change in terms of small technique to suit the culture and language and the people who attend the meeting, because we have range of people who attend the meeting, from very professional down to very low knowledge about AMR. So we have to adjust the language to suit all sort of career and professional and education level.
Okay, thanks. And before I hand over to Makwellings to answer that question, could you just tell us, there's a question from Sonal Katyal. How long was your engagement program? How long were the activities?
You mean for Thailand?
Yeah.
Okay, Tasawan will answer.
Sure.
Thank you. Okay. For the national virtual adult conversation, we took 3 months on 3 hours per monthly for 3 months. And for national youth virtual conversation, we took total 1 month, 3 hours per week for 3 weeks. And for regional conversation, actually, we plan to do like the event monthly for 4 months, but because of the COVID-19 restriction, we try as much as I can. We try as much as we can to conduct around at least 2 months per event. Yeah, it will total from last year. Our project started in 2021, yes, until now, and we are still ongoing.
Just to add a bit, the event itself, it doesn't take long. For example, the virtual conversation, even though the event take just 3 hours per time, but the preparation in terms of inviting participants, selecting participants, looking at a gatekeeper, finding those people, it takes so long in terms of preparation, which I think the Welcome to Kids allow us and prepare us to prepare those phases before getting into the event.
Okay, well, thank you for that response. Over to McQuellings, just to that first question.
Okay.
Yeah, over to
you.
So
the first question about whether we adapted the tool. Yeah. So yes, we made changes to how we could implement like the number of events for each group. So for example, the tool talks about at least 9 events with each group. But for us, we found that this was not feasible. And so we reduced the number of conversation events for each group to 5. So rather than doing 9, we did 5. So this was for reasons of we're conscious of the fact that we were taking people's time. People had to leave their livelihood activities to participate in this event. So we didn't want to continue disengaging them from their daily routines. So we were conscious of that. This is why we had to adapt and take that approach that we thought would work. But and the other thing that we adapted was when to engage specific stakeholders in this. Like at what point do we introduce, for example, chiefs in the conversation events, being aware of the power dynamic. So firstly, we wanted an environment where the community members were comfortable to discuss things that were close to them and then find the solutions on them without interference from, say, policymakers, local policymakers. So we try to adapt to that. So we often introduced these local policymakers at a time when solution had sort of been identified and kind of prioritized. And then these local policymakers were coming in just to provide this further feedback or input into how these solutions can be effective and feasible. So that's one of the things that we adapted. And in terms of the other question was how long the activities were. So for us, each session, I would say, lasted for a day. Each event lasted the whole day. That's starting at 8 to around 4 p.m. So, and each event had several sessions. So if we had to count how many sessions per event, then maybe 4 sessions. So we had a full day where with multiple sessions. So to answer your question, each event lasted the whole day.
That's great. Thank you, McQuellings. Thanks for that. So can I ask both of you? This is a question from Nadi Stadler. Thank you for the great ideas. Please, could you comment more on ways some relevant stakeholders, such as the local regulatory authorities, for example, may join efforts and are readily contributing to the current efforts to help disseminate information and increase awareness? Maybe we can, McQuellings, you started talking about stakeholders. Maybe you can continue.
Yeah, so one of the stakeholders here that we been engaging are drug regulatory authorities. So we introduced them at a time time when the participants or the groups had identified solutions. So for example, one of the solutions that people proposed was strengthening drug control mechanisms. So they had suggested several steps that can be taken to sort of control or manage drugs in Malawi. And then we invited over the officers from the regulatory institutions to sort of hear what the participants are proposing, but also to share the strategies that they are using to sort of manage or control drug usage in the country. So at this point, we're both hearing what can be done, but we're also hearing what is already being done. So there's that exchange of information and seeing what participants are proposing can improve what is going on, or whether these regulatory institutions can completely take these new solutions and implement them. So this is how we've been working with stakeholders to ensure we do, yeah.
Thanks, Makwelings. And over to you, Tasawan and Ravikanya. Can you talk about your stakeholder engagement and how stakeholders may contribute to your work?
Yeah, thanks. I'm Pensy, part of the team again, so I'm helping the team to answer the question. So in terms of stakeholders, as the project aim to provide recommendation to the national level, and part of our design is try to gather all the information from the regional level. So in terms of stakeholders, when we look at the national level, we engage people from the national level, like Ministry of Public Health, FDA, and any other main key stakeholders who play a role in the AMR in Thailand. That's at the national level. And when we did the, and also in terms of communication and media and university professor, university staff, that's at the national level. And in terms of the regional level, because we want to hear and provide opportunity to all the people who are engaged with. So we invited any local stakeholders from the sub-district level, village level, sub-district level, and up to the provincial level, and including those involved in administration, school, education, husbandry as part of the One Health idea. So we try to include as many stakeholders as possible, including any local level who are interested and have worked with the local administration in AMR idea. So that's what the way we try to engage and involve people who are working in that area as much as we can.
Thanks very much for that response. Can I ask, again, back to Makwelings? This is a question from Adrian Brink in Cape Town. I'm quite interested in this as well. Makwelings, you mentioned that there were no terms for antibiotics, and I think in Thailand as well. You mentioned that there were confusions between anti-inflammatory drugs and antibiotics. Can you tell us whether you had to formulate new terminology? Can you tell us a bit more about that?
Yeah, so that's a serious challenge for us, has been a serious challenge for us. So rather than coming up with 10 specific terms for, say, for antibiotics or antimicrobial resistance, we're kind of using statements to sort of make the explanation clear. So we can't use two words or a single word to describe an antibiotic. So, and that's why I mentioned about working with a linguist to see how best we can communicate and this information. So to answer your question, and an hour ago, I just sneaked out of our last meeting with a group of Med community members, and I left a debate as to what can be done to come up with a proper terms or definitions for these scientific terms. And there was a lot of discussion, people saying, what do we do? We need to come up and find alternative, local terms for this. Otherwise, communities, the public doesn't understand what we were saying, because we're saying antibiotics. I don't know what an antibiotic is there. And this is what is leading to people using antibiotics irrationally, because they don't know whether it's an antibiotic or not. So we still have a long way to go, but we're working on it.
That sounds like a really kind of logical approach to go to your audiences or to your communities and ask them for advice on what terms to use.
Yeah. So and I forgot to mention, maybe can I still add on that?
Yeah,
so
of course,
you talked about how we're engaging stakeholders. So now this is our last group, and now we're preparing to hold a national stakeholder workshops. So the initial stakeholder workshop we had I would say had a limited number of stakeholders, because we're still in the process of mapping out stakeholders. But now through these responsive dialogues, we've identified other stakeholders that people feel should be engaged. So when we're going to sort of disseminate what we've learned and share the solutions that people are proposing and the recommendations, we're inviting more stakeholders and then to share with what people think can be done. And then we're also going to look at ways of communicating AMR in Malawi. Yeah.
That's great. Thank you, Makwelings. So over to Thailand.
Yes, it's me again. In terms of terminology, we admit that it has been using very confusingly across the meeting that the event that we use, and the result that we hear from the community, and people use interchangeably between antibiotic, anti-inflammatory, and that's something that the misunderstanding that we found during the event. And as McQuilling said, it's a long way for us as well in terms of defining that right terminology that we can use for people to understand. Because in Thailand, when we talk about antibiotic, people don't understand at all what does antibiotic mean. Is it virus? Is it fungi? Is it what? So they don't get the concept of what is the antibiotic, what is the antibiotic mean. So we normally, in terms of direct translation, it's a drug killing germs. So that's a direct translation. So when we talk about germ, we don't really understand what germ means. So because the direct translation doesn't imply what kind of microbial for us. So that's what we also, a long journey for us to try to find out what is the right terminology that we can send the right message to people. Thank you.
Thank you very much for all of you for that response. We've got 4 minutes left, and I've got quite a big question. I'm going to try and combine 2 questions. One of them is from Isatao Sar. Isatao is asking, what are your this question. What do you think? Well, the question Isatao is getting at, and also referring to Julius Ojulong's question on, how training institutions are being engaged, or how should they be engaged. The question is, how do you initiate a culture change, do you think, so that people learn about AMR and address it in different ways? What do you think are your overall impressions in a minute and a half, McQuellings?
So for me, I would say, for me, the approach that works is sort of basically creating an environment where people just have these discussions with themselves and and also the sector to sort of discuss what I think the problems are. The framing part of like what is a problem, to define a problem, you need to sort of give people a platform to discuss that on. Like when you talk about the training institutions, for the training to be informed, you need to sort of give people space to sort of, so you can learn from them, and then that learning can inform the training materials that you need to develop. First, like before, what we've done is, not just me, but what I mean, the usual approach is trainers come into a community and teach people what they think is right for the communities to do. I think you first learn what the communities are doing, and then bring in what you have and also share it with the people. So you first should learn rather than, because when you are teaching people, you kind of closing them, you're kind of shutting them. They're not able to share what they think about the problem. That's my suggestion.
Thanks, Makwelings. And over to Thailand, what are your views very, very quickly, please, in a minute, if you can.
Okay. So very quickly, so, to change the belief in the culture is also, it's very hard because, people in the community, they have like this set of beliefs, like, if I'm sick, I need antibiotics, something like that. So, and the doctors in Thailand, sometimes in the community, it is also very hard because if you go to the hospital, they don't give you the drugs. Why do you go there in the first place? So this is some of the beliefs in Thailand that we're trying to fight against. But then at the same time, people in the training in the community, they say like, if we give the power back to the community, if we have information about AMR, if we have any like information or cases, like I said in the presentation, if we are able to give that back to the community, they might felt that the problem is closer to us, it is related to us. Yeah, thank you.
Okay, well, thank you for your participation today, and a very big thank you to our fantastic speakers. The recording of this session, along with additional materials, will be shared, and you'll be able to find that in the links that have been posted in the chat. We look forward to seeing you at the next webinar in the community engagement within research uptake, the webinar series in July 2022, where we'll explore engagement with sexual and gender rights. Information will be available on the Arch and Mesh hubs. So many thanks again for your participation, and thanks to the speakers, and goodbye everyone. Have a good day. Thank you.
Bye, thank you.
Thank you, bye.